Hey guys, good morning. So it's 7 a.m. and I've just done my COVID swab for in preparation of my tonsillectomy. So this is the booklet that it comes with, and I haven't taken the video while I was doing it, but I've already actually done it, and it comes in this labeled box, which you need to assemble afterwards. Put your sample in a clear um, sample bag, where you seal it and then put it in this box, and then you put the security seal and then you can post it. So for me, today is a Sunday. I had to call. There's a number that you need to call. It's on the booklet for a courier to come to your house to collect the sample. But if you have like a priority Royal Mail post box near your house, then you can just drop it. So this is fine. Let me cover the code. But yeah, here you are. It comes um, labeled, and I will get the results in 24 to 48 hours. And then after 3 days is my procedure. So let's see. So before today, I actually didn't think much about the procedure. I know it's a simple procedure, although I think I may have been putting it off. I am anxious about it, even if it's a simple procedure. And then yesterday, I I met someone, one of my friends who had a tonsillectomy a year before, and according to him, the first 3 days are fine. I think it's because you had anesthesia and all that, so you can eat fine without any pain and whatsoever. But after 3 days, when most of your anesthesia and even the analgesia after the procedure, when you're in the ward recovery, wears off, then he said that it really is very, very painful. So that's not something I'm looking forward to. They did say on the pre-assessment appointment that it will be painful, that I need to stock up ibuprofen and paracetamol in my house. Yeah. And then yesterday on my way home, I took an Uber, and this lady who was a driver also said she had a tonsillectomy, but this was back in Canada, and it was the most painful thing she had experienced in her life. So that got me a bit anxious, because she said that she's given birth to um, two children already, but the pain after the procedure of tonsillectomy was worse than her, birthing pain. And for me as a nurse, I know that giving birth is one of the most painful thing, according to the books, and according to the patients I've had before back in the Philippines, and when I was catering to um, patients who just gave birth. So for her to say that is really scary. Well, not really scary, but sort of made me anxious. But yeah, it will be quite painful. Also, my friend also said that in the first 3 days after the procedure, the area where they took out the tonsils kept bleeding. That he had to sleep while sitting down in an upright position, so that he wouldn't suffocate, not suffocate, he wouldn't aspirate on the blood. So it's not something I'm looking forward to now. So what I'll do today is I'll read again. Well, I haven't fully read the literature, typical. So I will read the full literature they've given me, and then see if there's anything else I can do to prepare, and then I will see you guys on my procedure day. Hey guys, so it's one day before my tonsillectomy, and I've read the literature that they've given me. If you are having your tonsillectomy and that's why you are watching this video, I just wanted to share the important points in the leaflet that you should take note. So first of all, I want to focus on the risk of tonsillectomy. Now, it's a very simple procedure. If you are working in healthcare, you know that it takes less than an hour. The only thing is that you will be under general anesthesia. And when you are general anesthesia, you'll be totally unconscious. And then, you won't know anything what happened during the procedure. You'll just wake up in either the recovery room or back in the ward, depending on the hospital protocol. So if you have been under general anesthesia, you need to make sure that you don't take alcohol or non-prescription drugs within the first 24 hours. Make sure you don't drive any vehicle and you don't operate any machinery that requires concentration, focus, because you might still be a bit dizzy, or your mind is out of focus because of the after effects of the anesthesia. And also, do not sign any legal document within the first 24 hours, because your decision making power or your capacity may be impaired. So that's the important thing. Now, in terms of the medical risks, it says here that sore throat is one of them, that you may have a sore throat for 10 to 14 days after the operation and expect the pain to get worse between the 4th to 6th day. So that's why it is also advised during the pre-assessment clinic that you need to ask or have or give a note for a 2 weeks sick leave post-operation. As I've said previously, with what my friend and the cab or the Uber driver said to me, after 3 days of having that tonsillectomy, they had very, very severe pain and needed to take round the clock analgesia. I am still anxious about it, because once you are under general anesthesia, you won't know what's happening. There might be complications, and one of them which can happen during the procedure and after the procedure is number 2, the bleeding. So it depends. Hopefully nothing bad happens, but you can have bleeding up to 2 weeks after the procedure. So it's gonna be my friend Anthony said that he was spitting like fresh blood for the first few days, and that he needed to sit up even during sleeping. So he couldn't lie flat because there's some sort of continuous release of blood. That was his case, and if you lie flat and that happens, then you could aspirate. So he said he was sleeping in a sitting position for the first few days. So yeah, I'm not looking forward to that, but that's one thing that we need to take note. So in case if after the first or second day you see some or you feel some blood coming out, then make sure you don't sleep flat, otherwise you could aspirate on it. Number 3 here, it says damaged teeth. So during the operation, there is a chance that we may chip or knock a tooth out, especially if it's loose, capped, or crowned. Now, I'm hoping this doesn't happen, because dental care here in the UK is very, very expensive. Please be careful, my dear surgeons and assisting nurses. The fourth one is infection. Some people can get an infection in their throat. This can be, manifested by increase in pain, having a fever, or a fresh bleeding from your throat. And it is very important that you comply with the food regimen to prevent this. Now, I'll tell you that food regimen in a minute. The last risk that they've mentioned here is nausea. So some people may feel sick after the operation, but we will give you some medication for this, and it usually settles quite quickly. So I think the main serious ones there are the risk for infection, bleeding, okay, and in terms of financially knocking out your teeth, that's going to require big money to fix. So in terms of the food regimen, so this is what they have advised. When I was back in college and I studied this procedure in one of the books, I read that you're meant to have like ice chips initially, then have cool stuff like ice cream, ice lolly, and then you initially start with soft food. But it seems like the times have changed, because it says here, so they've got this leaflet here and it says, what do I eat after my operation? Now, they said it is very important that you eat crispy, crunchy diet to remove the white slough at the back of your throat and to try and prevent a post-operative infection and bleeding. So examples of crispy or crunchy foods are cereals, toast, crackers, biscuits, crisps, and apples. So like they want you to eat this food because they grab some of the white sloughy tissue from the throat and pull it downward. They bring it. These are basically dead tissue that are left over after the operation. So slowly they will remove themselves from the main tissues of your throat. But apparently this type of food help to sort of like sweep or scrub them off, and just swallow them and they get digested or whatnot in your stomach. So it also says here you can eat normally but do not eat soft food only, okay, as it highly increases the risk of infection and potential bleeding. So with soft food, there is a tendency that like for example, you're eating mashed potato or yogurt, that they can stick in the areas where your tonsils were removed. And if they stick there and they are carrying some sort of, even light forms of bacteria, or or they stick there for a long time, if you don't brush your teeth, you don't gargle, you don't drink enough water, then they can stick there and they can prevent healing and possibly cause infection. So that's why don't eat just soft food, okay. And it says here, it is very important that you drink lots of fluids, and you may find it easier if they are chilled. That will also, the cold will also constrict your blood vessels, and that will reduce the chances of bleeding. And it will feel really, really good, especially when there's pain. It will feel good as well. Now, avoid acidic drinks like orange juice and spicy foods, as they will sting, especially when you have a wound on your throat. Okay? I will be having my surgery tomorrow at 11 o'clock. That is just the sort of admission time. Of course, I will have to sign in, be admitted, and have a preparation. And I think I might go into theater at around 12:30 or 1 p.m. And usually it takes less than an hour. And then once you wake up from the general anesthesia, I think they give you between 2 to 4 hours. They let you stay for 2 to 4 hours, and to make sure that you're fully awake and you've got all your senses back. And also they've put here that you need to have an escort. Now, it's very important you have an escort because you just had general anesthesia. Although you may feel like you're okay, there is a chance that you may still be confused, or maybe when the nurse asks you or checks your orientation, you're able to answer the questions, but later on there might be things that you forgot, very confused about. So it's important, and for your own safety, that you should have an escort as well to go home with. And they even put in the leaflet to stay with you as well for the next 24 hours. Fortunately, I do have a housemate, and someone is there in case anything happens. Okay. And since my admission time is 11, I am allowed to eat light breakfast before 7 a.m. I can have a toast or a bowl of cereal. I need to stop eating after 7, and I can have water up until 10. But from 10 a.m., nil by mouth, or nothing by mouth. So I can't eat or drink anything. I'm not even allowed to chew gum. You're not allowed to smoke as well. And it says you do not drink alcohol the night before your operation. Those are the important stuff in the literature. So let's see how it goes. To be honest, I'm trying not to be anxious or fearful about it, because I know it's a simple procedure, but there is still that anxiety, there's still that fear of the unknown, like what could happen. But knowing that I've spoken to 2 people who've had this before and they were fine, or even if Anthony had a sort of bleeding first few days, he's fine now. So that sorts of reassures me, and hopefully through this video as well, you'll be able to see how my experience is. So I'll take a video post-op day 1, day 2, and day 3, and so you can see what the progress is, what I am experiencing, and just so you know what to expect, and therefore that you'll reduce your fear and anxiety regarding the procedure. So that's it for now, and see you tomorrow morning during my procedure.